Anyway, Doki, my eye see something as I dey come your place today.
Kunle, I trust you. You are never without gist for me. What did your eye see?
Omo Doki, as I dey stroll come your side, I see this small pikin. E go be like 10 or so, but I don't know anyway. As the boy dey waka go, na him fall for ground. Start to dey shake, dey foam for mouth. Omo, everybody first clear, but after small time, I see one mama wey she run go meet the boy, carry spoon for hand. The way she force the spoon enter the boy mouth, omo, I fear o. E be like say I even see small blood sef. Before you know am, mama sef dey shout, alubosa, alubosa, onion, onion. Na I dey wonder say, wetin dis woman wan take onion do? Before you know am, one mama for one corner dey shout, ino, ino, FSS, ino. To put in leg for fire, for why now? Omo, I confuse o.
Kunle, sounds like that boy was having a convulsion. And as usual, our people did the things they know best to do, like forcing spoon into the mouth, putting onion in the mouth and in the nose, and more ridiculous practices like putting the leg of the child in fire.
Doki, me I even dey fear for the people wey dey touch the boy o. No be warapa the boy get. Me I no fit near person wey get warapa o, make e no go quarrel me.
Your stark ignorance is very heartbreaking, Kunle, I must say. But no wahala, as usual, I will educate you. Convulsions occur when the brain cells begin to misfire, like what you have in a power surge, or like our people will say when transformer blow. And as a result, all the muscles begin to jerk uncontrollably.
Doki tun ti gbede o. Transformer dey blow for head. Okay o, wetin dey cause am?
There are different possible reasons why a child or an adult can have convulsions. Some temporary, some permanent. And in many cases, the causes are not contagious, so you don't need to run away from them. In fact, in many cases, they need your help to survive without serious injury.
Doki, you go hard me to near person wey get warapa o, but I go try adjust sha.
Kunle, though warapa is a Yoruba word used to describe epilepsy, it sounds very derogatory. Many people with epilepsy are not to blame for their own woes, so we must stop the stigma.
Okay, Doki, I hear you. Tell me about the different things wey dey cause warapa or, sorry Doki, convulsion.
Okay, Kunle, to start with, a low blood sugar can cause a child or an adult to go unconscious or even convulse. And this is commoner in children, especially in newborn babies, when they are left for a long time to sleep and they are not fed every 3 hours as they should be. Also, in children between the age of 3 months to 5 years, a very high temperature can cause a child to convulse, especially boys, and if such runs in the family. Another common cause of convulsion, especially in children, is something we call meningitis, which has to do with infection of the covering around the brain. It can occur anywhere, but it's more common in certain parts, like in the northern part of our country, and it sometimes occurs in seasons, which is the reason why we sometimes will ask about travel to specific areas. And of course, there is cerebral malaria that can cause a child to go unconscious or have convulsions.
Baba, this ordinary malaria again? Anyway, you don't tell me say malaria na bad guy wey fit humble anybody, whether adult or pikin. So Doki, wetin fit cause this boy convulsion wey dey around 10 years old? As I see the boy dey waka, e no be like say he's sick before he fall down start to dey shake bigi.
Well, I can't say for certain because I don't have specific details. But besides those in which epilepsy runs in the family, there are certain situations that can occur in children that can cause them to continue to have convulsions into adulthood.
Doki, elaye me, educate me, Baba.
So, Kunle, babies that do not cry immediately they are born can have injury to their brain because of the lack of oxygen that can cause them to convulse there and then, and even when they fully recover, they can have issues with their development and they can continue to have convulsions into adulthood. The same can happen with children who have a severe level of jaundice. You know, that thing that causes the baby's eyes and body to become yellow. Then again, meningitis, if very severe or not well treated, can cause problems that will cause convulsions to continue to happen into adulthood, including other problems like loss of vision, loss of hearing. Of course, A brain tumor, stroke, bleeding into the brain from whatever cause can also cause convulsions.
Doki, children fit get brain tumor?
You have forgotten our discussions about cancers in children so quickly? Of course it can happen. So for this child you spoke about, we may never know exactly what caused his convulsions, but I hope they were able to help him to get to the hospital. The boy needs to be checked out, get proper diagnosis and treatment for his convulsions, because with every convulsion, further brain damage occurs. Anyway, I guess the greatest concern for me is people being so ignorant about what to do and what not to do when they see someone around them having a convulsion.
Doki, yarn me something.
Well, firstly, like I told you before, running away from such people can't be the solution. And while this practice of forcing spoon or other items into the mouth is supposedly to protect the tongue from being beaten and getting injured and bleeding, the harm that using this spoon in the mouth can cause can be worse. In some cases, they can dislodge the teeth and it goes into the breathing pipe, and then the child begins to choke. This is besides all the tears and injuries that can happen to the mouth in the process.
Okay, Doki. Onion and fire and go.
Well, the answer is obvious, Kunle. Putting onions or whatever it is in the nose or the mouth of someone who is convulsing is of no benefit. And of course, putting the child's leg in fire is an inhumane and wicked practice that is of no use whatsoever. Most people convulsing will recover within 5 minutes, except in peculiar situations where you may need to help such a person to the hospital.
Doki, you don't talk wetin make we no do. Okay now, so wetin we fit do to help person wey dey get convulsion?
Well, Kunle, you must start by looking around to ensure that there is nothing harmful that can hurt you, the rescuer. Afterwards, the much you need to do is, if necessary, move the person away if the person is convulsing in an unsafe area, and put the person lying on their left side while supporting them during the convulsion. Of course, you must be careful, because if the jerking is very vigorous, they could hurt you. All in all, keeping the person safe from harm and waiting it out where possible for about 5 minutes is the summary of what you need to do. You can subsequently help the person get to the hospital for a checkup afterwards.
Baba, you don't blow my mind today as usual. Make I come dey go. Titi say make I hail you wella.
Okay, thanks. Do extend my regards to her, Mr. Kunle Olofofo, the investigative journalist extraordinaire. See you later.